Hi, this is Dr. Robert Brueck, continuing our series on basic cosmetic procedures, giving you a little background information as to what they are, what to expect. Now we're going to talk about abdominoplasties, commonly called tummy tucks. It's an integral part of what we call the mommy makeover, and I'll make a few comments about that as well. Basically, an abdominoplasty or tummy tuck is a procedure and operation whereby we take care of excess skin from the abdomen. In some cases we tighten the muscles, in some cases we add liposuction. The one thing I always tell patients, whether we're talking about the tummy or the face or the breasts or the thighs or whatever it may be, when you have loose skin, it's got to be removed. And for example, women come in, they've got this loose, flabby skin with a lot of stretch marks, and I hear a common story. Well, my husband told me to do another 1,000 sit-ups. Well, I can tell you right now and assure you, you can do 10,000 sit-ups. It's never going to go away. So when we do a tummy tuck, what we focus on are three things. Number one, the degree of laxity and stretch marks that are present on the abdominal wall. Secondly, when I do a tummy tuck, I like to contour the middle portion of your body. In other words, somebody may have bulging hips, so when they put on their panties or their shorts, they get that bulge of fat overlying the belt line. So we like to address that through liposuction. The third thing we see a lot of times is people have weakness in the abdominal wall. That is, their abdominal muscles bulge. It's due to two things. Number one, it's due to weak abdominal wall, and it's due to the fact that our rectus muscles, they're a paired muscle, they get separated as the uterus develops, as the baby develops in your womb. And as those muscles separate, you get weakness to your abdominal wall and it bulges. So during the course of the abdominoplasty, we tighten it. The other reason we sometimes get bulging in our abdomen is that within our abdominal cavity, we have abdominal fat. Now that can't be corrected. That's through diet and exercise. And so I tell people it's important to distinguish between fat exterior, underneath the skin, weak abdominal wall, and intra-abdominal fat. So we try to correct the exterior fat and the abdominal wall as best we can. As I mentioned to you earlier, when I do a tummy tuck, I many times will recommend that we turn the patient prone. We suction their flanks, so instead of bulging convex, they're concave. It really contours the midsection of the abdomen. I sometimes will suction fat from the superior part of the abdomen, above the belly button, to thin that out. And then usually the incision will go all the way across the lower abdomen from one hip to the other. And that incision will be based on how much excess skin there is. If there's less, the incision's shorter. If there's more, we extend it. And many times women come in, they've had a previous C-section. So what we'll do, we'll incorporate that incision into the abdominoplasty incision. We then will undermine to the rib cage and separate the skin and fat from the underlying muscles, tighten the muscles, remove the excess skin, put a drain in, put a binder on, go to recovery. The operation is done usually under heavy sedation or general, depending on whether we're going to turn the patient or not. It takes about 2.5 hours to do, and the patient goes to recovery room and then they go home. One of the critical things after a tummy tuck is early ambulation. So I tell my patients that first night, go to bed. Put a pillow under your knees and just sleep. That's the key thing. There will be a drain in place. Now that drain will stay there 4, 5, 6 days. When it stops draining, we take it out. Usually I'll let my patients shower the next day. So what they do is put on a bikini brief or a bikini bathing suit bottom, take the drain, clip it to the bathing suit or panties, take a 5-minute shower, dry off, put their binder on, and then walk. What's really, really important is that you walk post-op or lie down with your feet up, exercising your calves. I have all my patients get embolic support stockings to prevent pulmonary emboli, to prevent stasis. And by exercising your calves and legs while lying in bed and keeping them elevated, you're moving that blood, circulating that blood, which is important. The drain, like I said, usually comes out in about maybe 4, 5, 6, 7 days. At that point in time, you're standing straight up, you're moving around, you're active. Physical activity, going to the gym, crunches, elliptical, jogging, running, probably 5 to 6 weeks. So the first 4 or 5 days, lay low. After that, let comfort be your guide. Again, the tummy tuck is designed to eliminate excess fatty tissue around your abdomen through a combination of tummy tuck and liposuction, tightening the abdominal wall that was weakened as a result of pregnancy, and thirdly, removing the excess skin, which is so common after multiple pregnancy. Now, a few comments on Mommy Makeover. Most women, after having gone through pregnancy, will have the effects of pregnancy affect their breasts as well as their tummy. Now, the effects on the breast will involve 1, breast becomes smaller, 2, there are stretch marks, 3, the breast kind of sag. And so we go ahead many times, we'll correct that through an implant or a lift, in addition to doing the abdominal portion of the Mommy Makeover. So if you have issues or questions concerning this, certainly feel free to come in. You can call my office at 239-244-2329, and we'll do a complimentary consultation. We'll see what your particular needs and desires are, discuss various options with you, and we can go from there. So it's a great procedure, tummy tuck. We do it in combination with part of a Mommy Makeover. And again, if you have questions, feel free to come in. The consultation's free, and we look forward to welcoming you to our family. Thank you.